You know those lab test results? The ones with all the numbers and all the weird medical terms, they can be a little overwhelming, right? I mean, especially when we're trying to understand, like, what they really mean for our health or even, like, the health of our family members.
Yeah. Yeah, no, absolutely. It can really feel like you're trying to put together a puzzle, but some of the pieces are missing.
Right, exactly. But, no worries, because in this deep dive, that's what we're going to do. We're going to help you make sense of all of it.
Right, exactly.
So let's just dive right in. Let's start with the basics. What's the point of these lab tests? Why do doctors even order them in the first place?
Well, it's not always just about figuring out what's wrong, like when you're feeling sick, right? Lab tests can actually do a whole bunch of things for doctors. Like, they can help pinpoint the root cause of your symptoms, maybe confirm a diagnosis that the doctor suspects, or like screen for any potential health issues. They can also help monitor how well a treatment's working, and even just make sure your medications aren't causing any, unwanted side effects.
This is not just like a one-size-fits-all kind of thing.
Nope, definitely not. It's more like a toolbox, with all sorts of different tools, and each tool has a specific job. Like, you wouldn't use a hammer to tighten a screw, right? So in the same way, like, doctors, they're going to choose specific tests.
Right.
Based on your own, individual health needs.
Okay. So let's say the doctor orders a test. You go, you get the test, you get your results back.
Mm-hmm.
What happens next? How do we even begin to, like, understand all those numbers?
Yeah.
What do they even mean?
Well, that's where things can get a little tricky.
Yeah.
But the first thing to remember is this. Lab results, they aren't like a report card where you just get a pass or a fail. It's a lot more nuanced than that.
So it's not like getting an A on your cholesterol test.
No, not quite. Think of it more like a piece of a bigger puzzle, okay? Your doctor doesn't just focus on the numbers themselves in isolation. They're considering your overall health, your age, family history, lifestyle habits, all of those pieces. They come together to kind of paint a more complete picture of your health.
Okay. So even if a number seems a little bit off, it doesn't automatically mean something's wrong.
Exactly. It's all about understanding the context. For example, let's say your cholesterol result is a little high. Now, that doesn't necessarily mean you're heading for heart problems.
It's like saying everyone with a lighter is a smoker.
Right. Maybe some are, but some are using it for a candle or to start a fire.
That's a great analogy. Just like with the lighter, there can be lots of reasons for a high cholesterol result. So your doctor is going to look at your family history. They'll ask about your diet, whether you exercise, all sorts of things to really understand your overall risk.
Let's say you're a younger person, no family history of heart disease, you're living an active lifestyle. Even with slightly elevated cholesterol, your chances of having heart problems, might be pretty low.
But if you're someone, let's say, with a family history of heart disease, and maybe you don't exercise as much as you should, then that same cholesterol result could mean something totally different, right?
Exactly. It's all about putting those lab results into the context of your individual health story. Your doctor, they're using all the information they have to make the best decisions about your care.
So it's really like it's like a detective, putting together all the clues to try and solve the case, right?
Exactly. And that's why it's super important to talk openly and honestly with your doctor, The more information they have, the better they can understand your results and help guide you in the right direction.
Makes sense. Now let's talk about those numbers that we see on lab reports. Sometimes they're within a normal range, and sometimes they're not. How do we make sense of all that?
Those normal ranges you see, those are called reference ranges. And basically, they're determined by testing large groups of healthy people to figure out what the average levels are for things like cholesterol, blood sugar, other substances in your blood.
So it's like figuring out what's typical for people of a certain age and health status.
Exactly. It gives doctors kind of a baseline for comparison. But here's the thing. Those ranges aren't, set in stone.
Really? I've heard that different labs can have slightly different reference ranges.
Yeah.
Why is that?
You're right, they can. Because labs can use different equipment and different methods for testing.
Yeah.
And that can lead to slight variations in their reference ranges. So it's really important not to compare results from different labs because those variations, they could lead to worry that doesn't need to be there.
So the takeaway here is, even if a number is outside the reference range, it doesn't automatically mean there's a problem. It's just one piece of the puzzle.
Exactly. Your doctor is going to look at the results and consider all the other information they have about you to figure out the best way to move forward.
This is all so helpful. I think we're really we're demystifying a lot of these confusing things about lab tests, right?
Yeah, I think so.
Just,
Knowledge is power. And the more you understand about these tests, the more equipped you'll be to, really take control of your health.
now, before we move on, I wanted to talk about something that's gotten super popular lately, and that's those at-home tests that you can buy at the pharmacy or online.
Oh, yeah. Those are becoming more and more common these days.
It really seems like there's a test for everything now.
There are. Blood sugar, pregnancy, UTIs, you name it.
So what's your take on them? Are they a reliable way to monitor your health?
Well, they can be helpful for sure in certain situations. Like, let's say someone needs to keep close tabs on their blood sugar. Or, if you think you might have a UTI, it can be a good, quick initial check.
So they can be like a good starting point, but maybe not the whole story.
Yeah, I think that's a good way to put it. It is important to choose reliable brands, or
Right.
follow the instructions very carefully. But, the key thing to remember here is this. Home tests, they aren't always as accurate as lab tests.
Okay. Why is that?
Well, because lab tests are performed in a much more controlled environment. They have specific procedures, and they go through very strict quality control measures.
And I'm guessing those little kits that we get at the pharmacy don't quite have the same level of rigor.
Exactly. Things like how you collect the sample, even the temperature of the room you're in, can actually affect the accuracy of a home test.
So if you're seeing any results that are, concerning, out of the ordinary, it's best to just check in with your doctor.
Absolutely. Think of those home tests more as a starting point for a conversation with your doctor, rather than a definite diagnosis.
That makes sense. This is all such good advice, and I think we've really covered a lot of ground today. From why doctors order lab tests to how to interpret those sometimes confusing results.
Yeah, I agree. We even, got into those reference ranges and the rising popularity of those at-home tests.
It's all about empowering people to really take charge of their health and to feel confident when they're talking to their doctors.
I couldn't agree more. Now, let's do a quick recap just so we make sure we hit all the important points.
Sounds good. We started out by talking about why doctors order these tests. They're like those clues in a detective story
Yeah.
that help them figure out what's going on with your health.
And we talked about how those test results, whether they're positive, negative, or even inconclusive, need to be looked at in the context of your overall health.
Right. It's not just about the numbers themselves. It's about what they mean for you specifically.
And don't forget about those false positives and false negatives. Those happen too. And they really highlight why it's so important to have a clear line of communication with your doctor.
Yeah, for sure. We also tackled those sometimes intimidating numbers and what they represent.
Mm-hmm.
Remember, those reference ranges, they're just averages. They're based on large groups of people that are healthy. They're not absolute rules.
And as we learned, different labs might even have slightly different reference ranges.
Right.
So comparing results from different labs can really be confusing and lead to unnecessary worry.
Exactly. And maybe one of the most important things we discussed is that even if a result falls outside of that normal range, it doesn't automatically mean something's wrong.
It's more like a yellow flag, a sign that it needs more investigation, a conversation with your doctor, not a red stop sign.
I like that. And then we talked about how information you already have, like your age, family history, your lifestyle, all of that plays a role in how your results are interpreted.
It's like having extra puzzle pieces, helps you see that bigger picture.
Yes.
And finally, we talked about those convenient at-home tests. But remember, it's always best to confirm any big findings with your doctor.
Great summary.
Now, for our final thought-provoking question, think about your own health history, your family's health history, and the lifestyle choices you make every day. How might those things influence the way your lab results are interpreted?
That's a really great question for everybody to think about. And remember, never hesitate to talk to your doctor about any concerns or questions you have about your health.
Exactly. They're your partner on this journey, and having open communication is key to getting the best care possible.
Well said. Thanks for joining us on this deep dive into understanding your lab results. We'll see you next time for another fascinating exploration.
See you then. They can be helpful in certain situations, especially for folks, maybe who need to keep a close eye on things like their blood sugar levels or, for a quick check, a quick initial check if you think you might have a UTI, that kind of thing.
Okay.
So they can be a good starting point, but maybe not the whole story.
Right, yeah.
That's a good way to put it. It's important to choose, brands that are reliable and follow those instructions carefully. But here's the key thing to remember. Home tests, they aren't always as accurate as the tests you get done at the lab.
Yeah. What's the difference there? Why is that?
Well, lab tests, they're done in a controlled environment. Yeah, they have very specific procedures, and they go through like strict quality control measures to make sure the results are accurate.
So I'm guessing those cute little kits we get at the drugstore don't quite have that same level of, I don't know, rigor.
Exactly.
Yeah.
Things like how you collect the sample, even the temperature of the room can actually affect how accurate that home test is.
Wow.
So yeah, it makes a difference.
So if you're looking at your results from your home test and something seems a little concerning, unusual, anything like that, it's always best to follow up with your doctor.
Absolutely.
Yeah.
Think of those home tests as like a starting point for a conversation with your doctor rather than a, definite diagnosis.
This is all great advice. I think we've covered a lot today. We talked about why doctors order these tests in the first place, how to make sense of the results.
Right.
Which can be confusing.
Yeah, they can be sometimes.
And those reference ranges and, even the home tests. It's all about helping people feel more in control of their own health and feel confident talking to their doctors.
Yes, absolutely.
Yeah.
Now, why don't we do a quick recap just to make sure we hit all the main takeaways?
Sure. Okay, so we started by talking about why doctors order lab tests. They're like clues in a detective story, helping them understand what's happening with their health.
Right. And we emphasize that those results, whether they're positive, negative, or even inconclusive, they need to be interpreted in the context of your overall health picture.
It's not just about the numbers themselves, it's about what they mean for you as an individual.
Exactly. And let's not forget about those false positives and false negatives. Those can happen. And it really highlights why it's so important to have, clear communication with your doctor.
Yeah, for sure. Then we talked about those sometimes intimidating numbers on those lab reports and what they actually mean.
Right. Those reference ranges, those are just averages based on large groups of healthy people.
Right.
They're not absolute rules.
Set in stone.
Not set in stone, exactly.
Yeah.
And as we learned, different labs can even have slightly different reference ranges. So comparing, apples to oranges can be confusing and cause unnecessary worry.
Exactly. And one of the most important things we talked about is that even if a number is outside of that normal range, it doesn't mean there's a problem.
Exactly. It's just something that maybe needs to be investigated further.
Right.
Talk to your doctor.
Yeah.
It's a yellow flag, not a red stop sign.
I love that analogy.
Yeah.
And then we talked about, things like your age, your family history, lifestyle choices, all those things play a role in how your results are interpreted.
Exactly. It's like having those extra puzzle pieces. It helps you see the whole picture.
Yeah.
And finally, we touch on those at-home tests. But remember, it's always best to confirm any significant findings with your doctor.
Great summary.
Now for our final thought-provoking question, I want to leave you with this. Think about your own health history, your family's health history, and the lifestyle choices you make. How might those things influence how your lab results are interpreted?
That is a great question for everyone to consider.
And remember, never hesitate to discuss any concerns you have about your health with your doctor. They're your partner in this.
Absolutely.
And open communication is key to getting the best care possible.
Well said. Thanks for joining us on this deep dive into understanding your lab results. We'll see you next time for another fascinating exploration.
See you then.